There are 26 participants on the call, including you. You are joining your conference as a participant. For a menu of available commands, press *#. Your connection is now in listen-only mode. Joining us today, the title of today's webinar is Public Health Partners in California's Active Transportation Program Development and Implementation. My name is Victoria Custodio, and I'm with the Active Transportation Resource Center at the California Department of Public Health. As you all know, Caltrans administers the Active Transportation Resource Center, and the Department of Public Health is a partner in its services. Our work is carried out through an interagency agreement with Caltrans, and specifically its Active Transportation Program. As part of the ATRC, it's our job to implement a statewide project that assists local communities with creating, implementing, and evaluating active transportation non-infrastructure programs, including Safe Routes to School programs, by providing tailored training, technical assistance, and resources. Also, our role is to support the active transportation program, and specifically the non-infrastructure awardees, as well as applicants, by providing Safe Routes to School and bicycle and pedestrian safety education, resources, and health-related program expertise. Next slide, please. We have a packed agenda this morning that we're very excited about, but we have to go over some quick housekeeping announcements before we start with our presentation. As shown on the slide, please use your phone for the audio for this webinar. There's call-in information and passcode. Our phones are currently muted so that we can minimize the background distractions. If you are having any difficulties with WebEx, which is the system we're using for our webinar, please click on the Contact Support link in the calendar invitation for this webinar. Next slide, please. All right. We are pleased to have the technology to record today's webinar, and we'll be posting it to our website, which you have on your screen above. Our website is casaferoutestoschool.org, and there's a specific link under Get Assistance and Webinars where there will be a recording of this webinar after we've finished up today. Questions and comments are always encouraged. However, the only way to ask a question is through the dialogue or chat box. You may type in your question at any time. And for today, we'll do questions and answers slightly differently than we've done it in the past. What we're going to do, because we have very wonderful presentations with a lot of dense content, we're going to have give each speaker a chance to answer 1 to 2 questions right after they finished up his or her presentation. And then after that, we'll have a longer Q&A period after all presentations have been completed. Okay, next slide, please. Now back to our learning objectives for today. As you know, this webinar will help orient non-public health practitioners to the public health approach to active transportation promotion. This webinar will also highlight how regional public health networks and their member local health departments are successfully engaging communities on active transportation efforts. Speakers are going to discuss helpful resources, tools, and regional opportunities for networking and collaboration. In planning for this webinar, our intended audience has been transportational professionals, but as with all of our webinars, we've opened this learning opportunity up to the broad network of stakeholders involved with sustainable active transportation program and planning and program development. So here are our actual objectives for today. By the end of this webinar, we would like for you to all be able to describe how the public health framework enhances active transportation planning and implementation. Secondly, we want to have you be able to give at least one example, of how either a regional public health network or a local public health department has partnered in support of active transportation development. And then finally, we hope that you'll be able to list at least one resource that can assist you with your local or regional active transportation planning efforts. Okay. And we've lined up a really wonderful group of speakers for today who are experts in their fields. We've got, is there a concern? Yes. Just a quick introduction with some bio work. Meredith Lee is part of our Health in All Policies team within the Office of Health Equity at the California Department of Public Health.
Meredith's presentation, Promoting Active Transportation Through a Public Health and Health Equity Lens, introduces key concepts to the public health approach to active transportation planning. She'll also share details about California's Health in All Policies initiative, and more specifically, the state's Health in All Policies Active Transportation Plan. Next, we'll have Will Dominy, the Policy Manager for the Bay Area Regional Health Inequities Initiative, or BARHII, as the first two speakers who will be highlighting the regional public health networks as active transportation partners. Will speak to BARHII's regional focus and how the region's public health network has been evolving, influencing, and providing key leadership on active transportation planning and program implementation. Corey Riley is a Healthy Communities Manager at Contra Costa County's Health Services, and he'll follow Will. Corey's presentation will provide an overview of how Contra Costa County Health Services has been engaged in HTP efforts and how participation in BARHII has benefited the county's HTP work. And our last speaker will be Carla Blackmar, who's the project manager for the Southern California Public Health Alliance. She'll round out our presenters today, speaking to the Alliance's role as an active transportation partner in the southern half of our state. She'll be highlighting the Alliance's recent successes and resources that are influencing the equity and impact of active transportation investments in Southern California. We are hopeful that today's presentation will spark a lot of questions. Feel free to enter your questions in the chat box at any time. After each speaker, again, we'll pause to answer one or two questions that may come in, and then we'll have a more robust question and answer period following all presentations. And then after that, I'll be wrapping up our webinar with a quick review of other helpful resources and a few closing remarks. So that's our list of speakers. And before we go any further, I've got one last thing that I'd like to do, which is on the next slide. We have one simple poll question to gauge who's in attendance today. So I'm going to let my colleagues set up the poll. And the questions are very basic. We're trying to gauge if you are already involved with public health or if you're a non-public health professional. So I'll give a couple seconds to let that register. And I think we've got 100% responses. Oops, still evolving. So is it going to give us, are we going to, all right. I think the poll has stopped, the screen has stopped moving. No, it's still going on. I think we're right at our 100%. Are we at our 100%? Go ahead and get, should I give it? Okay. All right, so it looks like we have about it's not quite half and half, but we've got about 44% of you all are working in a public health department as either an employer or a contractor, and then we've got 48% who are not in the public health department or as a contractor, and a couple of people who are staying silent on the webinar, which is a-okay with me. So that's our audience. Meredith, are you ready and queued up to be our first presenter?
Okay, I just unmuted myself. Can you hear me?
We can hear you loud and clear. Great, Meredith. Thank you so much. And on that note, I'd like to turn it over to Meredith Lee. Thank you.
Good morning, and thank you so much, Victoria, and for everyone for being on the webinar. Again, my name is Meredith Lee. I am with the Office of Health Equity in the California Department of Public Health. And I really appreciate those of you, both from the public health sector and from the non-public health sector, for participating. For those in public health, my presentation is going to be a little bit of a review for you. It's more meant to be an introduction for those not in public health, but luckily my portion is relatively small, and we'll move on to the examples. So please go to the next slide, please. So just an overview of my portion of the talk today. I, again, am setting up kind of the foundation for our later speakers. So I'm going to be focusing a little bit more on theory as opposed to what's happening on the ground. So we're going to talk first about the drivers of health and equity. and then transition into the relationship between public health and transportation, and looking specifically at the direct and indirect impacts on public health. And then finally, at the end, would introduce a concept called health in all policies and the opportunities to improve both health and transportation through using a HIAP approach. Next slide, please. Okay, so starting out with a little bit of theory. So the slide in front of you, this is a framework originally from BARHII, the Bay Area Regional Health Inequities Initiative, who we'll hear from in a minute. This framework is supported by a number of other public health models, which I'm not going to go into right now, but later presenters will touch on, including the socioecological model and the spectrum of prevention. But just a little bit about this diagram. So for years in public health, we've really focused on kind of the right side of this framework. So really around the risk behaviors, disease and injury, and mortality. And that's what most people think about when they think of public health. These are those critical functions that public health plays, including providing vaccines, doing diabetes control, fall prevention programs, and then risk behavior programs like healthy eating promotion, smoking cessation, physical activity campaigns, and more. And these are all, again, they're really critically important and necessary, but they're also all really fairly downstream and really focus more at the individual level as opposed to at the larger system or built environment level. And what we've learned from this is that simply telling someone to eat healthy or to be physically active is really hard when they live in a community where there are no groceries or where they're bombarded by just fast food advertising and the only food access they have is at a corner liquor store. Or if they live in a community where there are no parks or gyms, or the community doesn't have sidewalks or pedestrian scale lighting and residents are afraid of physical violence. So in order for us to address these issues about like healthy eating and physical activity, we need to move further upstream, so moving to the center of the framework towards the living conditions. And in particular, thinking about, for this webinar, thinking about the physical built environment in which the individuals and communities that we work with really live. In public health, we can talk ourselves blue telling people to eat healthy, but if they can't afford and can't access that healthy food or those physical activity opportunities, we're never going to make a difference in terms of those downstream indicators of health, like obesity rates. And so we really think about how do we make the healthy choice the easy choice. And in terms of active transportation, it's not just how do we make the healthy choice the easy choice, but how do we also make it the safe choice. Which brings me to my next slide about the relationship between public health and transportation and why we're here today. So I'm not going to go too deeply into all of these. I referenced here at the bottom of the page a document that we wrote with the organization Transform that goes into a little bit more detail. But in terms of the relationship between public health and transportation, there are a lot of direct and indirect impacts, and really thinking about the public health side. And so I'm actually going to skip over physical activity and come back to that in a couple slides. But starting with the collision injuries and fatalities, well, actually, just to go through the list at first. So a number of direct impacts. So in addition to physical activity and collision injuries and fatalities, there's also a direct impact around air pollution, climate change, and stress and mental health. And really focusing in on first that injuries and fatalities, if we, so from motor vehicles to pedestrian and cyclist collisions, motor vehicle collisions are the major cause of death and injury and are the leading cause of death amongst those ages 5 to 34. And in traffic injuries, we're seeing that 18%, this is from numbers from 2009, so it's a little bit older, but that we're seeing 18% of deaths and 90% of hospitalizations and 9% of emergency department treatment for pedestrian and bicyclists. And those are huge numbers when we talk about the proportion and relative risk. So moving on to air pollution, I'm, again, not going to go too much into detail on all of these, but just in terms of the direct impact that transportation has on air pollution, we know that auto emissions auto and vehicle emissions impact air quality and contribute to impaired lung development, lung cancer, asthma, and other chronic respiratory diseases, as well as heart disease. And then climate change, our transportation sector, it contributes about 38% of California's total gross greenhouse gas emissions. And so it has really major impacts on climate change. And from a public health perspective, the American Public Health Association and a number of our top leaders in the field have actually identified climate change as the #1 threat to public health in terms of the changing climate, which can impact anything from heat illness, effect of higher ozone levels, extreme weather events, vector-borne diseases, and more. And then finally, the last direct impact that I want to talk about is around stress and mental health. And again, thinking broadly about transportation, commuting during rush hour traffic can be a really highly stressful experience. And there is actually a lot of data out there showing the cortisol levels of folks who commute via vehicles and the relationship that has on stress. So that was just a quick kind of background on just some of the direct impacts about why, especially in public health, we like to think about transportation and the potential opportunities to address some of these causes, root causes. So if we go to the next slide, and looking at the indirect impacts that public health, that transportation has on public health, and again, I'm not going to go into all of these, but access to jobs, access to services and medical care, household expense, displacement, gentrification, social cohesion, and social network. So these are the things that people don't often necessarily think about first and foremost when they think about public health and transportation. But we know, especially from an equity standpoint, for low-income families who either can't afford a car and really have to rely on public transit and active transportation as their primary means of accessing different services and jobs, it's a critical intersection in terms of those indirect impacts. Also, in terms of household expense, again, from an equity perspective, today about 90% of the household's budgets are spent on getting from place A to B, and for low-income individuals in particular, this is a significant portion of their disposable income. And from a public health standpoint, when we're thinking about families spending 19% of their income on transportation and then up to 30% of or more of their income on housing, it means that there's far less disposable income for other things like those healthy food choices, like other amenities that can actually help promote health. And then finally, the last two around displacement, gentrification, and social cohesion, especially in light of things around the governor's goals around reducing VMT and moving towards transit-oriented development, there's a great opportunity to reduce greenhouse gases, but also we really need to think about those communities who have historically been in locations that are now being identified for transit-oriented development and the potential that this has for displacement and gentrification, especially of those lower income, often communities of color. And just to note that when these communities are displaced, that social cohesion and social networks can oftentimes be disrupted, which can have another really important and dramatic effect on public health. Okay, next slide, please. And then one more. Thank you. Thank you. Focusing back on specifically on active transportation and public health. And when we talk about active transportation, we actually, in addition to walking and biking, we also oftentimes include transit. Often just because with the transit, we have at either the beginning or end, almost all start with a bike or walk trip. So in terms of active transportation and thinking about physical activity, we see really huge public health benefits when we get people walking and biking more. And additionally, recognize that this is a key strategy around reducing greenhouse gases and that contribute to climate change. All right, so next slide. This is just, I'm going to dig in a little bit deeper into the active transportation and health impacts around physical activity. So there have been a number of studies that show that increasing physical activity by as few as 18 minutes a day through walking and biking has a really huge potential impacts on public health. And the numbers on the screen are the anticipated change in disease burden by increasing physical activity from 4.5 minutes to 22 minutes, and this is from a Bay Area study. And a number of MPOs in California and around the country are now using this modeling tool. It's called ITHM, or the Integrated Transport and Health Impact Model, and scenario planning to see how different scenarios can actually impact public health, and specifically focusing on this aspect of active transportation and physical activity. And we can see from the slide that we have significant reductions in diseases including cardiovascular disease, diabetes, depression, dementia, breast cancer, colon cancer, at rates that are in public health kind of unprecedented from our traditional strategies. It is, however, important to note that you see on the bottom in the red that when we are seeing increases in active transportation, so biking and walking, but there is also an increased risk of injuries and fatalities for pedestrians and cyclists, which really highlights to me the point that when we're doing this type of work, we actually need to integrate into all of our practices appropriate safety and educational campaigns to ensure that we're using the infrastructure in an appropriate manner. If we can move to the next slide. Thank you. So I'm not going to go actually into these slides. I just wanted them more for your reference if you want to come back to them. I will just note that ITHM, the tool that's being used, is an open source scenario-based Excel based spreadsheet, and it was originally developed by some colleagues in the UK, and then is housed currently jointly with the California Department of Public Health and Dr. Neil Maislich, who recently retired from the department. And if this is something you're interested in learning more about, please, my contact information is at the end, so please contact us and we can help put you in touch with the appropriate people. I would also just like to say, if you look down at the bottom, from just an increase up to 22 minutes a day of physical activity, we see about a 9.5 months of life increase, which, when you take it as a population, is actually a huge increase in life expectancy. And what oftentimes speaks to many of our decision makers, it actually has a huge monetary value of co-benefits, with estimated in the conservative end $1.4 billion and then up to $22 billion of savings. Next slide, please. And the next slide, please. So to shift gears just a little bit, I wanted to introduce and talk a little bit about approach to doing some of this multi-sectoral work that folks online may find interesting. I know we have representatives from different sectors. So health in all policies is a collaborative approach to improving the well-being of all people by incorporating health equity and sustainability considerations into decision-making across sectors and policy areas. Next slide, please. And we have learned through doing this work that at the state level, it can be really hard working across sectors. We have different languages, we have different processes, we have different timelines. Government tends to be very siloed. And for us in public health, many of the decisions that have the biggest impact on health are really outside of our jurisdiction. And so for us in health, this is a really important approach and strategy to being able to help address some of those, again, upstream drivers of health that we don't normally actually have access to. Next slide, please. So just a little bit of an example from the state level. So in California, we have the California Health and All Policies Task Force. And I'm actually staff to this task force. And so we bring together 22 different departments and agencies across the state. Through consensus decision-making and a focus on co-benefits, we identify areas of what we call win-wins, or those co-benefits, to identify to actually improve some of those upstream drivers of health. We've been around since 2010, and we sit within the Strategic Growth Council, which is a cabinet-level coordinating body that works on environmental and climate change goals. So next slide, please. So we have action plans, which is how we organize our work with the task force in a number of different areas, but one area that we do a lot of work in, where I spend a lot of my time, is on our active transportation action plan. And this is, again, it's a multi-sectoral action plan. So we have commitments from over 15 agencies and departments throughout the state. And the idea is that we are not necessarily trying to create new work. And instead, our real goal is to actually look for opportunities where we, by working together and identifying shared goals, can actually improve the process and improve the outcomes so that they benefit public health as well as the direct agencies that we're working with. So the goals of the action plan are, again, to increase opportunities for safe and accessible active transportation for all people, to reduce greenhouse gas emissions, and promote health and equity. Next slide. And we do this by focusing on a number of key areas. So in particular around grant making, and so we've been very involved with the Active Transportation Program. We do a lot of work with long-range planning documents. So the California Transportation Commission is just now wrapping up their regional transportation plan guidelines, which we were very involved with. We do a lot of work with stakeholders in terms of disseminating materials and also gathering materials and sharing those back up. We work very closely with our schools, with the Department of Education and local districts to look at school siting and how students get to and from school. Also thinking about our state employees, as there are over 2,000 state employees, how are we contributing to improving the public health, or improving the health of those employees, and also making sure that we are also reducing our greenhouse gas emissions. And then finally, looking a little bit at how do we systematize and standardize our metrics to meet our statewide goals. Next slide. And then this is my final slide before I turn it over to Will. A couple of things that we have learned from doing this for the past almost 7 years now is that when we're doing cross-sectoral work, focusing on the co-benefits or the win-win opportunities has been a key strategy to, getting people to come to the table and then staying at the table. We don't provide additional dollar resources to our partner agencies, but we're able to provide people resources in terms of bringing the right folks together into the room and to facilitating those conversations between our multiple sectors and ensuring that we're able to actually identify those co-benefits. And then also the other key benefits or key to success is looking for those, creating those efficiencies and reducing redundancies. And recognizing that we work in an environment and increasingly with scarce resources, and that when we can do more with less and do it more efficiently, it benefits government as a whole and our stakeholders. So I believe that is all that I have. I will pause, and then Victoria, we're going to open up to a quick question.
Yes, Meredith, that was wonderful. Thank you so much. We just have one question that's actually coming from within the room, and hopefully we can take a little bit of time to answer it now. But if it's a longer question, we can answer it as part of the Q&A at the end. With regard to your slide about grant-making opportunities under the Health and All Policies program, can you just share some of the active transportation-related grant-making opportunities that are coming out of that task force?
Yeah. So just quickly, again, the task force doesn't do new work. So we work with existing programs and existing grants. So in addition to the Active Transportation Grant Program, which is administered by the California Transportation Commission in partnership with Caltrans, which we support through the Technical Advisory Committee, and then also on a number of work groups to embed, specifically looking at the health question, the disadvantaged communities questions, and then also recruiting evaluators to help do the review of those grants. A couple other potential grants that are coming down from the state level, the Affordable Housing Sustainable Communities Grant Program, which is administered by the Strategic Growth Council, has components that are eligible components around active transportation, which is really exciting. It is a very, I will say, just as a caveat, it's a very complex grant program, and it is a true multi-sectoral collaborative approach in that you really need a partner in just transportation, and it's trying to marry transportation and housing together. And so really, you don't have to be co-applicants, but it helps the application a lot. So, but that is one area where they're really focusing on active transportation. And then there's a brand new grant program that was just launched or just approved in the most recent budget called the Transformative Climate Communities, the TCC, which is focusing on our most disadvantaged communities in the state, and it's providing, there will be a competitive portion of the grant where looking at just what are the gaps in some of our highest need communities, you know, whether that is specifically transportation related, or is that green, is it housing, is it a number of other services, in thinking about the whole community, the complete community. But active transportation, again, is an eligible component of that. So those are the ones off the top of my head.
That's wonderful, Meredith. That's really helpful, and maybe we can work with you offline and in follow-up to this webinar to actually get some of that information out to our networks for anyone else who might have those same interests in funding opportunities, again, with the caveat that it requires a lot of upfront work and collaboration with our partners in housing as well as in transportation and public health. So, but I thank you for your wonderful presentation, and in the interest of time, we're going to actually move to our next speaker, who is Will Dominy. Will, if you can give us, thank you again, Meredith. Will, if you can just give us a heads up that you're ready to go.
I'm ready to go. Can you hear me?
Yes, we can. All right, everyone.
Great. All right, thanks, Meredith. You made my job a lot easier by laying out a lot of the big picture, kind of the lay of the land that we very much share, although we work at a more local scale at the regional level. So I'm Will Dominy. I'm the policy manager with the Bay Area Regional Health and Equities Initiative, which is kind of a mouthful. We often just say BARHII. I also work with Carla Blackmar, who's going to present in a little bit at the Public Health Alliance of Southern California, and then also with our next presenter, Corey Riley, who works with one of our member health departments in Contra Costa County. So this is a great collaborative effort here. And I'm going to try to be relatively terse so I can turn it over to Corey so that he can talk about the real work on the ground. Next slide. So just to give you a quick overview, BARHII is a collaborative of the 11 local health departments in the San Francisco Bay Area, and we work together to develop collective strategies to address health inequities at both the regional and the local and increasingly at the state level. We were founded in the mid-1990s when public health directors in each of our counties realized that the issues that they were dealing with in their counties were actually much bigger than they could deal with, and that they needed a regional scale effort in order to address some of those issues. So starting in 2002, we were officially founded, and it's grown to include all of the 11 health departments that you see on this map. It's given us an opportunity to share resources, build upon each other's best practices, address challenging issues together, and create a regional learning community around health equity. And I would say that active transportation has been a really big piece of our work over the years, so I'm excited to be a part of this webinar. Next slide. So this is a map that's kind of a more accurate depiction of how we actually see our region. And it shows life expectancy at birth by census tracts in the Bay Area, with red being relatively low life expectancy and green being places that people tend to live quite long. We see between the lowest life expectancy and highest life expectancy census tracts an almost 25-year difference. So think about that for a second. That's 25 years that are cut off of people's lives, and that difference is almost entirely preventable. So at BARHII, we work to understand where is that coming from, and then to figure out how we can actually change those dynamics and you know, move towards an app where we're actually all the neighborhoods in our region are green. Next slide. So addressing health inequities, so these differences, preventable differences in life expectancy and disease burden is extremely difficult. And no matter how good our medical care is, we know it's only about 10% of the picture in terms of people's health. So we have to look at strategies that help people stay out of the doctor's office or hospital in the first place. And doing this requires a really big picture of health. We tend to use the World Health Organization's definition of health, which I think is really helpful, that health is a state of complete physical, mental, and social well-being, and it's not merely the absence of disease or infirmity. So it's not just like, are you sick? It's like, are you fulfilling your full potential as a human being, and how can we, as government agencies, help you get there? Next slide. So Meredith already showed this slide, which is the BARHII framework, and it's something that many organizations around the country are now using. And if you, and I'll go quickly again because Meredith already covered this, I think, elegantly, but on the far right side, what we often talk about as downstream are the traditional areas of focus for public health, so hospitals, clinics, medical care, risk behaviors, and what I think what BARHII has really done, along with folks at the state, along with the Alliance in Southern California and many other partners around the country, has really pushed the conversation to the left to think about living conditions, so in this case, transportation, our transportation infrastructure, to think about institutions. So for example, the county member health departments that we work with, how do we actually transform institutions? And then also social inequities, so thinking about the gaps in health outcomes by race, class, gender, immigration status, sexual orientation, and other factors. And as Meredith already said, to work effectively on the issues on the left side of this, we really need partners outside of public health. And we found really great partnerships in the transportation field. Next slide. So I want to be a little bit more specific and just ground this in a specific issue around transportation. And in a second, hopefully you'll see a map of Contra Costa County. And soon you'll be hearing from Corey Riley about the work that they've done in Contra Costa County on active transportation. And I actually used to work with Corey in Contra Costa and can say they've done incredibly innovative work over the long haul, over decades, to integrate transportation and health, and he's going to tell you a little bit more about that. But I wanted to just show this slide to illustrate a health inequity. These are collisions, walking and biking collisions in Contra Costa County, with red being places of very high collision rates, and Corey will soon be talking about work that they're doing in those specific places, and those are places that tend to be very poor, not have a lot of resources, not have a lot of investment, and really need extra support, which is what Contra Costa is really doing. And also, there are places that have historically been disinvested, so it's not just extra support, it's also kind of like making up for past inequities. Next slide. So I want to talk very briefly about the nuts and bolts of our organization. We're a collaborative of member health departments. So again, we're shaped by all the 11 health departments in the region. Our decision-making and most of all of the work comes from our member counties. If we were a body, our organs would be our committees. We're steered by an executive committee made up of folks from a number of the different, or all of the different health departments. And then we have a policy committee and a built environment committee, and those are the sites of most of our work on transportation. And those are places that we've shared strategies that have worked on transportation at a local level. We've also used those committees to partner with our regional and state agencies to incorporate health into planning processes. For instance, we spent many years working to integrate healthy active transportation into our regional transportation plan. Next slide. So these are just some of the ways that we work, and again, I want to move through them relatively quickly to give Corey some good time to talk, but one of them is really changing the narrative about problems and solution. We found bringing a public health perspective can really shift and break up kind of stuck conversations. For instance, helping to get moving local governments around active transportation. Someone might not think a whole lot about pedestrians, but when we start talking about health outcomes, we find that decision makers and the general population are much more willing to think about new and innovative strategies. We've helped build new capacities, for instance, helping member health departments hire new staff and build out policy and planning units. And then we're also a community of practice. So we've helped incubate new ways of thinking and new directions in the work. For instance, there's a lot of work now thinking about climate change and health and how those two things go together, how they relate to active transportation. And those are conversations that didn't happen several years ago that within BARHII, I think we've had some really rich conversations that then move out into practice. So with that, I'm going to end and turn it over to Corey.
You're up. Corey, can you give us a sound check to let us know that you're up, that we can hear you? You don't get too far into your presentation? We're not hearing you right now, Corey. You might need to unmute your phone. Corey, if you can unmute your phone, maybe give us that *6 and then give us a verbal shout out that you're, because we're not hearing any audio at this point.
Gotcha.
Okay, you there?
Finder.
All right, wonderful. Thanks so much, Corey. Thank you so much, Will.
All right, thank you, Will. I'm sorry, I'm a little under the weather, so please bear with me here. My name is Corey Riley. I work at Contra Costa Health Services, and my presentation today is really geared towards planners and why I think it's mutually beneficial for planners to reach out to their public health departments and partner on common goals. Go to the next slide. So this is already covered, why does it make sense for planners and public health to be working together on common goals? So I won't recover this ground, but caveat that everyone's different. All jurisdictions are different, all the counties are different, all the cities are different, and so there are different conditions really even within Contra Costa County. There's a wide variety of what the capacity of the local planning departments are and what the, and I'm sure that, plays out across the state, across the nation. Some cities in Contra Costa County have health ambassadors that are hired by the city that are working under the city manager's office who are really out there being the voice of health in the communities. And then in some other cities, the planning and transportation staff is so understaffed that they have a hard time, getting things done, and they really just don't even have time to think about adding health to, their workload. So it really varies, and I'm not speaking on sort of every case, or I'm never telling people what they should be doing. This is just kind of an experience, the experience that we have in Contra Costa and the work that we've been doing here. I do want to emphasize that a lot of this is really focused around, like was stated before, creating efficiencies across agencies. There are co-benefits to these partnerships, and I think that they really make sense, and they really end up making dollars and cents too. We've been able to partner on bringing some funding into Contra Costa County using these strategies. Next slide. So we are the health department for the entire county. I work in a program called Community Wellness and Prevention Program. And so we specifically work on the counties that that have the highest rates of health disparities, low income, chronic disease, low rates of education, low rates of car ownership, high rates of rent burden. So we really focus our efforts on in the program that I work in these counties. Next slide, please. And just a comparison, so the top is the low-income census tract, and the bottom map is from CalEnviroScreen 2.0, just to give some common frame of reference for planners, who are working here. And I know that CalEnviroScreen is currently undergoing revisions, and these boundaries might change. But as you can see, there's a lot of overlap with the communities that are being identified at the state level as being, high need with the ones that we've traditionally been working in as well. So you can go to the next slide. More simplified version of the various different frameworks. This is another public health framework that we use in Contra Costa, the spectrum of prevention. And so again, we're really focusing on not just strengthening individual knowledge and skills, but we're really trying to work on fostering those coalitions and influencing policy and legislation, try to have a well-rounded program when we're addressing these complex health issues in our community. Next slide, please. A little bit of history about Contra Costa's partnership between their planning staff and their health department. We have an internal working group of staff that we call PITCH, the Planning Integration Team for Community Health. This was established by our Board of Supervisors in 2007, and it includes staff from our Departments of Conservation and Development, which is our planning, Public Works Department, and Health Services Department. And we meet every month, and we talk about various health planning issues, grant applications. We are working on updating our Complete Streets, and we're working on Complete Streets implementation. Our board has just now directed us to start working on a Vision Zero, which is looking at having zero or moving towards zero injuries and deaths by pedestrians and bicyclists being hit by motor vehicles. We work together on our climate action plan, on school siting issues at the state level, and we're always looking to increase our funding working together. And so this is just a group that the board established, and it's been really helpful for us to be able to coordinate on these issues. Next slide, please. One of the great collaboration projects that's come out of working with our Public Works Department in particular is our Safe Routes to School program. We've had our Safe Routes to School program since 2009. We're currently in 24 schools. And, the health department was able to apply for these grants, but we needed to partner with our Public Works Department because they're the ones who have the master agreement with Caltrans. So we really need to be working with them and coordinating with them so that we can accept the funds and administer all the funds and stuff too. This Safe Routes to School is working on parent engagement, doing encouragement activities, forming walking school buses where kids meet at a certain area and walk to school every day, doing assemblies. And we've been doing this for a long time, and I think that one of the biggest assets that comes out of this kind of work is that we have long-term engagement with the community, and we've been able to, through the years of running this program, build up a lot of community trust. And so that's an asset that we're able to provide to the various planners and public works departments in cities when it comes time to do these grant applications. I'll talk a little bit more about that. I'm going to go to the next slide. So aside from just the Safe Routes to School program, we have been applying with our Public Works Department for grant applications where we incorporate infrastructure changes, but also non-infrastructure programs and educational activities. And so this is just a picture from one of our recent projects where we did this. This is in Bay Point in East Contra Costa County. And this application was an ATP grant, and this included not just infrastructure changes to add sidewalks and bike lanes to a particular road, but we also wrote in there that we were going to be doing community education and assemblies and getting people talking about safe walking and safe bicycling, specifically targeted at elementary and middle schools in that area. And so these kind of grant applications we're able to get funding for our program, but also get funding for the infrastructure changes as well. So next slide, please. I'm sure most of you are familiar with the Active Transportation Program. In the application itself, there are points that are awarded for if your project benefits disadvantaged communities, if it results in increasing walking and bicycling and reducing injuries. You also get points for having public participation, public input into the plans, and if your plan is going to improve public health. All of this stuff is public health stuff. So there's a good incentive for planners to reach out to the Public Health Department to work on these grant applications because, a lot of this stuff is public health language. And then also regionally we have the One Bay Area grant in the Bay Area, which has various complete streets requirements, similar kind of requirements as well. And then One Bay Area specifically is about 4 or 5 years old. It de-emphasizes geographic equity. So basically it means that they are looking to focus their funding in certain neighborhoods, certain areas of the cities as the cities choose, But that's been sort of our approach in community wellness and prevention program in the public health department all along, is not trying to, as they say, spread the peanut butter thin across the entire county, but really focusing on those areas that have a history of being disinvested and that really need the most, catching up and help to alleviate those health inequities. And so I'm just going to now go through. You can go to the next slide. Some examples of this community engagement process looks like that we've done. This is kind of the Cadillac version, and so at the end of this, I'm going to talk about, what you can do if you don't have the time and resources for something that's expensive. Usually these processes, they can take, 9 months to a year. They usually start off with some kind of a training where community residents are gathered. We tend to schedule these at days and times when it makes sense for the community, so evenings, weekends, and then in this we go over what are some of the street and road treatments that can support health, various safe crossings, various types of bike lanes and all that, and just give people kind of a primer so that we have a common language that we can work with. So next slide, thanks. And so then after we do the training, we will usually go out and we will evaluate the street and the road that we're really focusing on, by taking measurements, by stopping at street corners. A lot of times we'll have maps where people can actually draw on for each of the various intersections. And we call these walk audits. Next slide, please. We'll come back. People will share their input, and then we'll usually have follow-up workshops where we then take, all the input. We usually hash through it and analyze it with the city staff or the county staff to see what's, viable. And then depending on the various recommendations, can break it out into, what's going to be easy win versus something that's going to take a long time or a lot of money, come back with follow-up workshops, and ultimately coming up with a community vision. Next slide, please. And these groups, they can really come from a lot of different places. So on the top of the slide here is a parent group at an elementary school in Concord that we worked with doing a walk audit. And that was, an existing group of parents who were interested in safety around their school, and so they were, a really great audience who was already passionate, already interested about these issues, versus, in below some organizations that we've worked and we've helped to pull people together who, in areas where there might not necessarily already be organized groups, pulling people together who are interested in these issues who can then, take the torch and run with them. So there are various ways to outreach to the community. And a lot of times, and I would suggest to the planners to talk to your public health department, see what their programs are, and see who the organizations are that, they're reaching. Go to the next slide. Click through a couple times there. Sorry, some animations I didn't get to take out at the last second. One more. So ultimately, we're looking for a community visioning process. After all that work, after all those workshops, we will then come up with a vision that we will then work with staff and decision makers to then, turning into the, engineering documents and the grant applications. We in the community that we're working with, we're not usually planners unless, you're one of the, there are a couple of public health departments in California that have hired, specific planners, but generally we're the health professionals, and so we work with the cities to then turn those into planning documents and engineering documents and apply for grants. And so this is just one example of a project where we were able to get $2.2 million to improve a street that was next to an elementary school and a park and a child care center, and it really connected across the community to various resources. Next slide, please. Click one more. And this is just a couple of different projects where we were working with cities on similar kinds of projects where we're outreaching to the community. And, it doesn't have to be that big and that extensive either. A lot of times, public health departments are already going to have programs where they're interfacing with the community. A lot of public health departments have funding from the state to do nutrition education, and so they're out there interfacing with the community. You know, a lot of, totally understandable that a lot of, city planning staff, you're busy doing your job. You don't have a lot of time to interface with the community and to be able to, go and know necessarily where those groups are. And so the public health departments often have programs where they are that interface. And so they can be a good resource for when you're doing these applications. Next slide. Sorry, go back, yeah. So again, I just wanted to, reemphasize that, these are public health things. And so the points on the application are awarded to these things, and these are often things that public health can help bolster those grant applications for. Next. One more click. And so it's not just always about getting grant funding for streets and roads. Through the projects like this, we've been able to raise about $15 to $20 million in the last couple of rounds of active transportation funding and one Bay Area grant funding. But we've also partnered with various cities on creating their bicycle and pedestrian master plans, sometimes even co-writing the grants with them. These are, large community-wide plans that are looking at, building out a bicycle network and making recommendations on various policies and programs that can increase walking and bicycling in the cities. And we've been able to have some of our staff, assist the cities in doing community outreach for the projects, doing community education so that residents are more informed about the kind of things that they can ask for in a plan like this. We've helped, in planning and running of the workshops, and then doing a health policy analysis of drafts of the plans. These plans are more specific, more topical, and I think really the best ones are when they have, good, robust community input. Where a plan like this is really going to be improved by having community input, because the community is going to be the experts of knowing where they want to walk, where they want to bike, what are the streets they want to avoid, what are the streets they want to make safer. These also have the benefit of assisting the cities in being more competitive for grant applications. So a lot of times not only are the funding sources that exist part of the information gathering and then put into the plan, but also this can help make grant applications more attractive to funders. In fact, one of our funders for the Bicycle and Pedestrian Master Plan in the city of Concord said that one of the reasons why we got the funding for that plan, to do that plan, was because public health was such, was so integral in the application. So having public health in that grant application actually helped us get the funding to do the plan. You can go to the next slide. These are just a couple of places that do fund plans. The Active Transportation Program does have funding to do bicycle and pedestrian plans. There's the Sustainable Transportation Planning Grant, which can fund various different kinds of plans. And then Transform has a local regional funding source, as I mentioned. And the California Transportation Commission, the organization that oversees the Active Transportation Program, has stated that they've intended to make consistency with approved active transportation plans a requirement for large projects in the future. So, that means having a plan like this is going to become increasingly more important for jurisdictions if they want to be applying for these competitive grant funds. And then next slide. That is the end of my presentation. So I'll open it up to questions.
Okay. That was absolutely wonderful, Corey, and Will, thank you so much. As we said earlier, we have time for a couple questions before we turn it over to Carla. So we have one question here, and this is for Corey. What would you say is the key factor that brings together different programs together successfully in Contra Costa County? So what do you think would be the key factor that allows you to bring different programs together?
The optimist in me wants to say health. We've actually really seen that a lot. A lot of jurisdictions have really been able to rally behind health as one of the key reasons to bring it together. You know, everyone knows someone who is suffering from a chronic disease, suffering from diabetes, and so it's very much the lived reality of a lot of the communities that we live with, and so the health banner is something we've really been able to rally behind. The sort of pragmatist in me wants to say money. Money brings people together. And so if you can bring people together where you are not only educating the community, not only creating, you know, community experts who are really interested in these types of issues, but then that then translates into funding for improvements on the ground, that can really have a big impact. And people, once people start to see change, they can sort of understand their own power and understand that they can have a voice in their community and how their community is built through funding.
Thank you, Corey. That was absolutely great. I'm going to hold off on additional questions at this time so that we can turn it over to our last presenter. Will, there are questions for you coming in as well. But on that note, I'd like to turn it over to our final presenter, Carla Blackmar. Carla, just a quick audio check. Are you on the phone and unmuted?
Yes, I am. Hi, can everyone hear me okay?
We can. Thank you so much. Go ahead.
Great. Hi, everybody. So I'm Carla Blackmar. I'm the project manager for the Public Health Alliance of Southern California. And thank you, everyone else who did the heavy lift for me with these great presentations. I especially really enjoyed, Corey, your discussion of the importance of active transportation planning in your conversation. And I hope we can, I'll try to get through my slides quickly so we have a bit of time to talk about how we can make sure that everyone knows that that's a priority for us in terms of state funding. Okay, next slide. So I am, as I said, the project manager for the Public Health Alliance of Southern California. We're a little bit like the BARHII of the South. We represent 9 local health departments extending from Santa Barbara all the way down to San Diego. And collectively, that is 60% of the California population. So it's a pretty expansive service area. You can go to the next slide. We formed in 2012. Similar to BARHII, our member health departments, I think, had realized that there was a lot of work that they needed to do collectively because it was bigger than any single one of our jurisdictions. And so our founding vision is that all Southern California communities are healthy, vibrant, and sustainable places to live, work, and play. Next slide. When we began, we actually did a bit of like a competition where we had each of our health departments bring in ideas about how we could advance this vision, and we voted on them. The winning concepts and the ones that we've focused on in the time since are healthy transportation, healthy food systems. We have a data in action committee that develops data to support both of those initiatives, and then as time has gone on, we've adopted a sort of twin lenses that we use to look at all of these areas, and those are climate change adaptation and mitigation, for all of the reasons that Meredith discussed, and health equity and equity in general. Next slide. Our Healthy Transportation Group has been in place since the beginning, and it's actually a cross-sector group kind of built off of that health and all policies model where we have, in addition to our local health department members, representatives from SCAG, SANDAG, a range of our local MPOs, and also from some of our transportation agencies and our NGO partners. We get together and talk about policy, review, and guidance. We look at state guidance that comes down. We try to establish best practices and kind of point the way forward for our jurisdictions on a range of transportation-related topics. Next slide. And if you're on this call and you're interested in joining, we would love to have you. So feel free to email me at the contact information at the end of the presentation if you'd like to join that group. So, you know, this is a rephrase of a lot of what we saw from Meredith, but we know that, you know, active transportation has tremendous potential to make huge changes in population health. And, you know, it's really, there's very few things that can move the dial in this way. Again, this is based off of the ISIM research done in the Bay Area. Next slide. Next slide. While we're getting to the next slide, I think that the challenge for us is, hopefully my computer is working. hopefully I think the challenge for us as practitioners working in active transportation is to figure out how we can actually deliver the benefits that really realize the promise of what active transportation could do in our communities. And I think that, if we ask ourselves, how do we really maximize the benefits of our active transportation investments, that one of the sort of underlying truths is we need to build things that actually get used. And I think this is something that's easier said than done. Next slide. So as I go around Southern California, I do take pictures of our active transportation investments. And, here's an area where we actually have a buffered, protected bike lane with a curb. But on this day when I was visiting, I was amazed and kind of chagrined to see that the majority of the people who were on bikes, and there were some, were actually riding on the sidewalk. And this guy's actually riding against the flow of traffic. So that's an interesting, some of these are a little bit of head scratchers. Next slide. My computer's updating. Another thing that we see, and we'll look at it on the next slide, is a lot of investment and really beautiful investment in these lineal bike paths and bike lanes that often go along transit or along a river. And one of the funny things about it is that they're beautiful facilities, but they often are highly underutilized. And I think a lot of times that is because the ability to use this type of a facility is completely contingent on the functionality of the infrastructure that helps you get there. If you don't have connections between people's homes and businesses, you're not going to see anybody on this bike path. And I think, again, this comes down to that question of, how do we really build things that get used, and how do we connect good facilities to places where people are already doing a lot of active transportation? Next slide. Here's a picture from Central Avenue in South Central Los Angeles. And this is an industrial corridor that has a lot of packing warehouses, clothing manufacture, and it's a very heavily used bicycle corridor, but the only option in this area is sidewalk riding. And it has very poor injury outcomes. And I think it's an example of the common reality that in the areas with some of our most vulnerable users, where infrastructure is most badly needed, it's often the hardest place to actually get those types of projects done. And there's a range of challenges that are in place in these situations. They come from political will, where there's competing priorities with the industrial corridor. These areas often have sort of poor and overcommitted infrastructure to begin with, where there's a lot of trade-offs that have to be made in order to provide that safe infrastructure. The staff in these areas are often under-resourced to compete for funding. Especially in Los Angeles, we have a lot of very small jurisdictions that have very little in the way of budget and staff resources to hire consultants or go out for the increasingly competitive state dollars. And then, there's just a lot of barriers that prevent the users of these streets from advocating for themselves. And we talked about those a little bit in the prior presentations, but those range from concerns over immigration status, language barriers, concerns over retaliation by employers, time constraints, and so on. We know, however, that investing the time and energy that is needed to do projects in these areas is a huge solution for improving safety, increasing physical activity, and ensuring that we get the most bang for our buck. And so I think one of the things we're going to talk about, or we are talking about today, is just how to use a public health frame to make sure that we're getting the most out of our investments. Next slide. So I think this is actually nice. It's a bit of a wrap-up of what I think we've already heard from people, which is that public health really brings some helpful things to the table. And I don't think that this is just specific or particular to public health. I think this is a model that public health and that we all would like to see everybody adopting. And it's really sort of three parts. The first is a frame that explains how systems impact behavior, and we've seen that with the descriptions of the BARHII model and the spectrum of prevention. Public health brings data that can really help make the case for these changes, and we bring expertise in working with vulnerable communities. And that's something that we really encourage and are hoping that we'll see our local agencies building out going forward. Next slide. So we talked about this with Meredith, but, public health moved from kind of a, educational model to a socio-ecological model. And I think there's actually an equivalent to this in planning. I'm a planner by trade, and I definitely see in planning and engineering a tendency to believe that if you build it, they will come. And I think that's really challenging logic, or problematic logic, because as we've seen so often, if you build it, people don't necessarily come. And that's when we see a lack of faith, I think, in the possibility of active transportation in our state. And so I think what we're trying to do is move thinking in planning and in engineering towards a socio-ecological model, because there's a lot of similarities. Next slide. Between the challenges faced by health departments and the challenges, faced by engineers and planners. And one of the things I think that we see is that the decision about whether to take active transportation, whether that's an option, is really influenced by a tremendous range of interlocking social, environmental constraints. Everything from people's interpersonal limitations to their school and work environments and those requirements, their neighborhood and their community, and then at the very kind of outer ring, the policy inputs and decisions that we all make that determine whether or not people can make that individual choice to use active transportation. And so I think that we're trying to move from that sort of if you build it, they will come, to something where we actually look at these interlocking areas. Next slide. The Public Health Alliance has worked to help spell out how to do this. We released some active transportation cycle 3 guidance that specifically asked how we could look at vulnerable communities and leverage sort of the socio-ecological model to make change in those communities. And one of the big things that comes up is how do we know what factors are most important to mode choice? And I think that we heard some great suggestions about how to do some of that community outreach from in the prior presentation from Corey. But I want to just talk about some of the resources that we've been providing as the Public Health Alliance as well. Next slide. Keep going, sorry. So here's another way of looking at the social determinants of health, the idea that there's all these interlocking social determinants that help influence our decision-making. Next slide. And one of the things the Public Health Alliance has actually done is build out an indicator that reflects these different categories ranging from sort of your economic resources through your social resources to the completeness and environmental hazards within your neighborhood. And we've built an index that's a bit like Callan virus screen. It goes down to a census tract level, and it uses the available public data to sort of create a score, again at a census tract level, that lets you know what challenges you may be facing from a social determinants perspective in your community. And our assertion is that this is just as important in doing an active transportation project as it is if you're a health department trying to figure out where to prioritize your funding. And we are proposing that this is a tool that many active transportation practitioners would benefit from applying or looking at as they begin, their outreach process and begin to look at what barriers may exist in the communities they serve. Next slide. It exists, again, it's online as a map. There's a link here, and hopefully you can access it. Next slide. When you click on the map, a dialog box pops up as shown on the right that includes both the indicator score for each of those different indicators in this index, as well as a percentile ranking, which you can use to understand where it might fall within the spectrum of the state. And you can actually download the data from our website, and you can scale it for your locality, and you can see where these different census tracts stack up in terms of your locality as well. So please contact me if you want more information on that. Next slide. And again, we've released some guidance on our website that talks specifically about how you can use this tool, this HDI tool, to inform your outreach, to inform how you do planning or actually build a project in these communities. And we definitely recommend that you have a look at that. And a big shout out to our health departments who helped create this guidance. Next slide. And there's the link. Next time, no animations. And so finally, I think the thing that's most important, and that's been a real focus for our health departments, is that, our funding is tied to the idea of eliminating health disparities, of making sure that people, no matter where they live, have, hopefully life expectancies that are much closer than the disparity shown here between 73 and 88 years. It's a huge difference and represents huge differences in terms of people's quality of life, long before they ever get to that average of 73 or that average of 88. And we have just stark inequities in our communities right now, and figuring out how to address those, I think, is a strength of public health and something that we would really feel strongly should be adopted across the board in the state of California. Next slide. Again, a lot of the work that our health departments have done has been, kicked off, I would say, through national funding from the CDC, from the Community Transformation Grants, and the Communities Putting Prevention to Work grants. San Diego Health and Human Services and Los Angeles County Department of Public Health were both grantees for these significant funding sources that looked at community-wide prevention and health equity. And that was really the thing that kicked off a lot of our regional engagement in active transportation. Next slide. And I'm going to just talk a little bit about specifically the work that's been done in LA County Department of Public Health. I'm going to try to do it really quickly because Shonda Singh from LA County is on the line, and she could answer any specific questions that you have. But I think the thing that's most compelling to me about the work that LA County has done is that they've really, like Corey, begun with assisting agencies to do some of that active transportation planning to make sure they know where their priorities and their needs are. And then using those plans, they've managed to, really assist people in the process of applying for the statewide funding that could help realize the infrastructure improvements that are related to that. And they've been very successful. Some of the jurisdictions that they've assisted, they've actually done some direct technical assistance, have had to apply a couple of times to our active transportation program, but in the end, most of them have been awarded for significant projects that I think will, are real game changers for some of these small and under-resourced communities. And I think that the story there is that, putting in the time with the very direct assistance and the very direct community engagement that is kind of a hallmark, I think, of public health work in these roles leads to the kind of genuine engagement that pays off in terms of both having grants awarded, but more importantly, in the end, having the facilities actually used. Next slide. Here's the picture of what looks to be a really amazing community engagement activity. And in the corner, you can see Nico Linish from LA County Department of Public Health. And, one of the things that Chanda was saying that LA County does a lot of in the terms of their direct assistance is just taking a really forgiving and flexible approach to working with some of these cities, understanding that they have a lot of limitations and just trying to figure out how they can do, for example, a warm handoff to other agencies that they may have had a hard time connecting with, folks, for example, at the County Transportation Commission or folks at the MPO. Just a lot of connection building, I think. And I think that's something that requires, it really requires kind of a commitment to the idea of equity in order to make some of those kind of forgiving, very small gestures that can, in the end, be the things that help jurisdictions move forward with this work. Next slide. The other thing that's been so compelling to me about LA County's work is their work in data collection and creating the data that allows us to prioritize where change needs to happen. And if you have a chance, do yourself a favor, go check out their Vision Zero website where they are prioritizing both based on accident injury, but also on, collision injury, pardon me, everybody, and also socioeconomic status areas that they feel the City of Los Angeles should begin with when doing these investments. And again, this is about not spreading the peanut butter, all very thinly all over the bread, but figuring out the areas, I guess you would say, with holes and patching them up. I think that might be where my metaphor fell apart. But again, this is, bringing the data and using data to prioritize funding and efforts to the areas of greatest need is one of the strengths of the health department approach to this type of work. Next slide. So I'm just going to end and say that I think that the vision here isn't that health departments are going to, always be serving in this direct service role, but rather that the model that we've all been describing to you today, that really focuses on, targeting areas of disadvantage, that's focused on using data and community engagement to do meaningful projects and projects that are responsive to the community. We hope that this is a model that will be adopted by everyone and will be reinforced by the way state guidelines are written. And we continue with the Public Health Alliance to try to make this happen. We welcome you to join us, and I certainly look forward to any questions that you have going forward. And I'll just end here with one more slide, I think, one or two. Here's the new Hollywood Scramble, and an example of sort of a great project dealing at a very, very high injury intersection in Hollywood. And one last slide with my contact information. And again, feel free to reach out to me. I saw that there were a lot of friends on the call today, and we all just look forward to thinking about how we can make this model work for us all going forward.
All right, that was wonderful, Carla. Thank you so much for that presentation. I'm actually going to ask Jane to advance to the next slide, and we have a number of questions that have come in, both from online as well as within the room. Carla, I'm actually going to give you the first question, and then I'm actually, I think the best way to do this is to have, if your audio, if your background noise is minimal, all speakers, if we can ask you to unmute your phone so that we can have you ready for questions as they come in. That'll minimize the beeping that we hear coming on and off the phone. But Carla, for you, the first question is, these concepts are fascinating and clearly complex. How do you bring non-public health entities on board to your work? Do you recommend training or any particular resource that can help make the case for broad collaboration?
Great question. And so one thing that we're actually in the process of developing right now that I think will be an asset is, I mentioned our Health Disadvantage Index, this online tool that we've developed, and we're actually in the process right now of developing a policy guide that, will essentially interact with a map where you click on, a particular census tract, and you get these scores, and then as you click on each of the components of the score, it will present both an explanation of what that data means, but also some very specific policy asks or policy direction that you can use to inform your approach. And so I think that, I'm a believer in data as a way of beginning the process, and I would say, I'm hoping that the development of some of these tools will help sectors that are not coming from health to kind of really think about the social determinants in a tangible way at, within their geography, and then the tool we're building out around policy will help people really think about how they can address those social determinants very specifically. And that, again, I think is the first step in a community engagement process, to sort of understand, what barriers there might be to that engagement to begin with, and to look at that at the outset and then use that to inform, that ground truthing that I think everyone has reiterated is so important as part of this public health approach.
Very good. Thank you so much, Carla. I appreciate that. I'm going to, I think this next question is also for you, and I think you might have mentioned it during your presentation, but do you have monthly calls, and is this available to anyone to listen in and participate across the state?
Yeah, every now and again we close our calls to just our health department members, but we will let you know. But other than that, everybody is welcome to participate, and we would love to have your participation. You can go ahead and send me an email and sign up.
Okay, great. I have a question. I believe this one is for Meredith. Where can we find the list of what grants are available that you mentioned earlier? And I believe that that's in reference. Thanks, Meredith. Sorry.
Oh, yeah, no problem. So those are all, the grants that I mentioned are all actually funded, well, note. 2 of those are funded through the Greenhouse Gas Reduction Fund, and so there's information on ARB's website, but also through the Strategic Growth Council. And then the Active Transportation Program, there's actually a new $10 million that was added to that that's greenhouse gas money, but otherwise, and in addition to that, information is available on the California Transportation Commission and Caltrans website. But I believe, Victoria, you said that you were planning on sending out more information to those who joined on the call about those grant programs?
We will definitely be following up with those lists so that people can have it in one place. We know that, yeah, those sources are from different entities, and it's sometimes hard to navigate where to go. So we'll try to do our best to get a timely list out to everyone so that they're aware of funding opportunities as they emerge, but have a centralized place. That's a great idea. The next question, thanks Meredith. The next question is for Corey about getting community participation for walk audits. How do you, what are your lessons learned about getting folks to participate in walk audits?
Lessons learned about getting people to participate. Well, one of the things that we've done is if it depends on where the call for doing a walk audit is coming from, I guess. And so if it's coming from the community group and they want to work on getting streets safer in their community, but don't really know where to start yet and don't necessarily have a certain street or a certain corridor selected yet, what we've done before is we've printed out large maps of the community and taken it around to various community groups, schools, parent groups, things like that, and had people just draw on them with markers, different colored markers, saying, where do you live, where do you work, where do you walk to, where do you want to walk to, where do you bike, and just getting all that drawing on there, and then looking to see what patterns emerge. And so then that can help us sometimes decide, okay, well, it looks like a lot of people would really like to walk down this street, or there's a lot of really important places to go on this street. Maybe we should focus on this street. And then, so that's kind of the outside-in approach of it. Sometimes when we're partnering with cities, the cities will already have the streets that they want to focus in on in mind. And so then it's just a process of finding who might be interested in this street. And so we have gone around to the community groups, the churches that are along that street, or that we know that that street is important to them. For one project, lessons learned, we did do a door knocking where we were able to sort of blanket the community that lived along the street. We knocked on, I would say, probably 400 houses, handing out flyers and inviting people to community workshops around the street in their neighborhood that they live right next to. And we got one participant at a workshop through that. So lessons learned, that was not a good use of our time. And we probably wouldn't do that in the future other than you know, maybe general mailers, but actually knocking on doors didn't really work. And so it's good to find the organized groups that are already organizing, and especially if they're particularly interested in health or walkability or bikeability or safety or, you know, children, something like that, then they're usually the best groups to engage.
Thank you so much, Corey. I think, and you know, just to summarize, I think clearly there's a wealth of knowledge and experience within your local public health department. That so if you're part of that half of the call group that's not working with public health currently, this whole webinar has been about how much public health can bring to the table with regard to engagement and experience. Carla was showcasing some of the good work that we know is happening down in the southern part of the state as well. So, and Will is a great contact for all of the health departments that are part of the BARHII network that are doing this kind of work as well. I have a couple more questions. I am concerned a little bit about time. Anything that we're not able to answer today, we have written down here the contact information. We can always get back to you with specific questions. I'm going to take one last question about data, and this is for Carla. Is there any data on pedestrian or bicycle exposure within the HDI tool?
I don't think so. But I think that's an area I will double check that. I don't think we have that built within our tool at this time.
Okay, fair enough. And we know that that's an evolving tool, but again, it's a great resource, and we'll be highlighting that in you know, in future communications. And then the last question, and I think again this looks like it's for Corey. Do you have evaluations of the processes that you've been using to, you know, as you do your community trainings as well as your follow-up and engagement? Do you have tools to capture the effectiveness of what you're doing?
We've done some pre and post surveys, measuring people's knowledge beforehand or competence in the subject matter beforehand and afterwards, and then we do pre and post evaluations of our Safe Routes to School program so that we can monitor load shift over the course of the school year. So those are a couple of the evaluations that we have.
That's great. Well, thank you so much. I think that's all that we have time for with regards to questions. Jane, if you could advance the next slide. Just a couple announcements as we wrap up. Your feedback is important. As we end today's webinar, be on the lookout for an email with a survey gizmo link. We're going to send that out later today to encourage everyone to complete a survey that will give us feedback on today's training, and it'll also be your opportunity to give suggestions about future webinars and assistance. Next slide. I want to thank all of our presenters today for this very, very informative call. This has been a wonderful opportunity to establish a foundation of understanding about the public health framework for active transportation and the true value that our public health community brings to this work. If you have any more questions for our speakers, their contact information is here. Next slide. And then finally, just as a reminder, your active transportation resource and non-infrastructure technical assistance coordinators are here to help you. Here's a map of our services. We encourage you to contact us with any questions that you may have. As you know, there is a regional lead for whatever part of the state you're in, and you have hopefully, for those of you that are funded through the Active Transportation Program, you've already been in touch with us. We serve as the point of contact for existing awardees, but also those that are seeking some support for engaging in this work. So on that note, again, I want to thank all of you who have joined us today, and special thanks to our speakers, Meredith, Will, Corey, and Carla. You did a fantastic job. We are grateful for your expertise and as well as your willingness to share with the broader statewide active transportation network that we support. We thank you for shedding light on the contributions of public health networks, the partnership, and practice, both at the regional and state levels and locally. So on that note, I'm going to call it a session. Thank you all for a great presentation, and everyone have a blessed day. Good luck.
Thank you.
Thanks, you guys.